which required us to make certain sacrifices and adjustments to our everyday lifestyles. This was the only way to effectively fight this war that we are fighting. As a people, we have had to flex our muscles against an invisible enemy with a lot of uncertainties about us. With a strong resolve, we have fought against mass spread of this virus, and we have registered significant gains. As we cross into the new month, let us strengthen our resolve against the virus. We must, at the same time, be wary of those who want to bog us down with sideshows and propaganda. We should not allow any distraction that can erode the gains we have made. Equally, we should not become complacent and feel that we are out of the woods. We are not out of the woods yet. As we move into this new month, we are still faced with uncertainties as to what trajectory our situation will take, and we must continue to prepare for that. As part of our strategy to fight the disease, we mentioned the need to check all cross-border truck drivers as they cross into the country. As members of the East African community, we have agreed on a protocol that will ease clearance at the border of all Kenyan truck drivers having to be tested from their point of origin, which is mostly in Mombasa. We believe that these discussions and arrangements we have within the EAC will be able to facilitate the testing of drivers in an efficient way, while at the same time not impeding the flow of trucks and cargo across the border. Regarding the opening of restaurants and eateries, let me reiterate that any facility that wishes to open up for business must do so after meeting the conditions and guidelines as outlined by the ministry, which I believe are now available on the website. Certification to open must be obtained from the public health offices in the counties. We are also aware that there have been reports highlighted in various media on a planned COVID-19 expenditure. I want to say that on this matter, our accounting team, together with our international partners, will issue a detailed report soon in the coming days. Fellow Kenyans, as we cross into the new month, I'm delighted to inform you that in the last 24 hours, we have been able to record 15 new discharges. This is the largest number of discharges in a single day that we have registered. This now brings to 144 the total number of recoveries. Within the same period, we tested a total of 777 samples from 14 counties. Out of these, 12 people have tested positive for coronavirus. 7 of these are from Mombasa, 3 from Nairobi, 1 from Wajir, and 1 from Kitui. You will note that the case from Wajir is a new one for that county. This brings to 396 the total number of positive cases in the country. The 7 cases in Mombasa are spread between Kuze, Old Town, 4, Bondeni 1, Bomani 1, and Kidunguni 1. The 3 cases in Nairobi are from Eastleigh, Fedha, and Kileleshwa. 7 of the cases were picked up by our surveillance teams, while 5 are from our quarantine centers. In total, we now have tested 20,268 cases. Today's cases are aged between 1.5 years for the youngest and 75 years for the oldest. In terms of gender, 9 are males and 3 are females. Once again, we are saddened to announce that today we have lost 2 more patients. This now brings to 17 the total number of cases that have succumbed to COVID-19 in the country. On behalf of the government of Kenya, I wish to pass our sincere and heartfelt condolences to the families of the departed. As I conclude, let me once again thank our people for the cooperation in this fight, and also urge us that let us not drop our guard, keep our vigilance, and strictly adhere to the measures that have been put in place. That is the only weapon that we have to prevent us against this pandemic. And I'm certain if we continue in this path that we shall be able to beat this enemy. I thank you.
Have said that the breakdown of the accounting numbers will be given at a later date. Let's start from the basics. How many patients have we had that are critical? How many are mild? And what is the estimated cost per patient? Because per patient in terms of treatment? Because what we know so far is the statement that you will be quarantined at your own cost. Thank you.
My name is Chemutai Goin from Citizen TV. Of course, you have mentioned that there were those cases that were in Kawangware. What measures are you putting in place to try and contain the spread? And Dr. Amoth, you had given the projections that by the end of April there would be a possibility of 10,000 cases. What figures are you looking at now with the fact that you've already commenced mass testing in specific areas?
Thank you. Just in relation to that, in terms of the projection that you were talking about, Dr. Amoth, you once said your worst fears would be 10,000 in April. We're way below, and maybe this is the reason why normalcy is slowly creeping in. And especially in the capital city, we are seeing an increased number of motor vehicles causing traffic jams, and businesses are reopening. As much as it is good that we're going back where we were, but it seems also that we are slowly creeping into normalcy. Is it a worry in terms of social distancing? That is one. And number two would be, in as much as the CAS, Dr. Raman, you've mentioned that, of course, the propaganda are a setback to the fight against COVID, and especially the numbers, because Kenyans have been reading, and especially on social media, about how this money have been spent, and now they're raising, eyebrows as to, the accountability aspect, especially from the Ministry of Health. What are some of the assurances that are going to give Kenyans? Because we are being asked by Kenyans very difficult questions. Myself, I was being asked if I've ever attended the meetings and had a share of the 4 million cup of tea. Thank you.
Okay. Thank you. Let me start with the first question. And that question really is around the information that is in the media regarding the budget. As I stated earlier, that this is a matter that is being addressed. In fact, Even as we speak, the accounting officer has prepared a statement on this matter, which will be shared with you very soon, possibly as early as tomorrow, if possible. So I think we will leave that to the accounting officer for her to detail that, and you will be able to raise your questions on that. You did ask a relevant question, which is how the case is segregated in terms of mild, critical, and severe. And I think I will leave the DG maybe to give us an indication if we have those figures. If not, maybe by tomorrow these figures should be available, the breakdown of the cases, as well as what it costs actually to manage these COVID cases. Chemtai from Citizen, you wanted to follow up on the Kawangware cases and how we are managing and containing those cases. You also asked about, just as the other question, your colleague next to you asked about the projections that were made. I think the DG will respond to that. But let me say a few things. Yes, of course, whenever we have a positive case in any of our densely populated areas, it's a matter of concern, because the disease is a disease that is transmitted through close contact. And that is really what all the measures that we have put in place are, is to be able to prevent that close contact which allows transmission. So the same measures need to be exercised, and even more strictly, particularly in areas where cases have been found and where there may be local transmission. As we said, and as the CS has said many times, the government and the ministry can do certain things, they can put in the right measures, but there is a responsibility upon us as citizens to also adhere and follow those guidelines. It therefore behoves each citizen to be able to adhere to those measures, to keep that social distance, to practice the hygiene measures, to avoid gatherings and places where people mingle. And basically, that is the only way that we can be able, through social distancing and hygiene measures, to be able to break the cycle of transmission. And that would apply for any place, whether it is Kawangware or any other locality that we may mention. And I think that is a thing that we will keep repeating here, because it is the only solution we have on hand right now. And I want to urge the media to do the same, so that people begin to adhere. And I think we are beginning to see improvement as we move along, as we keep taking this message through. I'm sure that people will heed, and we'll be able to contain the growth of this curve of ours. I want to hand over now to the DG so that he can respond to some of the other questions that you had raised. DG.
Thank you, CS. I'll start by Chemutai of Citizen regarding the projections that we have had earlier. Again, as we mentioned previously, modeling is just defined as a disease pattern projection based on specific data at a specific time. And the modeling information that you get is not a target to be met. It's not that if you say that you project that you are going to have 1,000 malaria cases, then you must hit that target. Modeling is usually based on a worst case scenario to enable you prepare appropriately to be able to overcome an epidemic or a pandemic like what we are dealing with. So modeling is supposed to help you determine the number of ICU beds that you require, the number of ventilators that you may require for COVID-19, the number of personal protective gear that you require for the frontline healthcare workers, the number of testing kits that you require, and the human resources for health that you require to be able to overcome the challenge. One of the challenges that we have faced has been the issue of testing especially in terms of sample collection kits. This could have skewed our figures because you remember there's a certain time we were able to test as high as 1,500. Then we went down to the 300s, now we are back to the 700s. So as we start the targeted mass testing tomorrow in Kawangware, we'll be better informed to be able to tell you. And again, modeling is not a statutory target. It keeps on changing depending on the data you input and depending on the behavior of the virus that you are dealing with. In terms of the number of patients and the distribution, we have about 210 patients in various hospitals throughout the country, all the way from the coastal city of Mombasa to Nairobi to the northern part in Wajir. Of all these 210, 208 of them are in stable condition. Basically, our healthcare workers are just observing them for any ill effects of COVID-19. It's only 2 who are in a critical condition on ventilatory support, but one of them is also improving. So we are hopeful for the best. In terms of behavior of the people, Kenyan people, yes, and this is not unique to Kenyans. You can only be able to hold people back so much before there's this urgent push to go back to what life was before. But our appeal to our people is that, as Waziri has said, we are not out of the woods yet. We need to maintain our guard. Let's ensure that we keep physical and social distance. Let's ensure that we wash our hands and stay at home. And through those measures and other measures that we have continued to articulate in our daily press releases, we shall be able to overcome. And that is why we are even saying that when you open restaurants, it is done in stages. It is not just a one-off thing that everybody will open in one go. We've put stringent measures and guidelines to be able to guide how we open these restaurants. There is a proper certification process in place and a proper inspection by the public health officers to be able to see that you meet the criteria for certification before you are allowed to open. So my final appeal to all of us is that we have made significant progress. Let's not lose our guard at this particular time. Let's continue with the measures. Let's continue to work from home for those of us who can afford to work from home. And let's maintain the physical and social distance. And working together and maintaining these measures, plus other measures put in place before, I think we are on the right path to be able to defeat this monster. Thank you. Tumemaliza ya leo. Yeah. Kesho pia ni siku.